Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 778,972 confirmed cases of COVID-19 in Canada and 268,211 cases in Ontario. Chatham-Kent has 1,164 cases, and Sarnia-Lambton has reported 1,833 cases. Michigan now has 559,241 cases, with 28,688 cases being in Detroit. Today we are reporting 60 new cases of COVID-19 in Windsor and Essex County. 6 are close contacts of confirmed cases, 11 cases are related to outbreaks, 5 are community acquired, and 38 cases are still being investigated. We have had 12,159 cases since last March. 11,214 cases are now resolved, and 629 people are active cases at this time. 73 confirmed cases are currently in the hospital, and 12 people are in ICU. Our community has lost 316 people to COVID. 211 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 40 active outbreaks in Windsor and Essex County. 17 are in workplaces, 17 are in long-term care and retirement homes, and there are 6 outbreaks in our hospitals. Second round of vaccinations for residents, staff, and essential caregivers of long-term care and retirement homes began on January 29th, and 5 homes have now completed their 2-dose series. We will be immunizing 2 additional homes with their second doses today. Despite the rollout of vaccine, please continue to follow public health measures. Stay home if you are sick. Limit your close contacts to your household members only. Maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. If you have symptoms of COVID-19, no matter how mild, please get tested by calling or booking an appointment online at one of the assessment and testing centers offered at Windsor Regional Hospital or Erie Shores Healthcare. SOHAC also offers testing for First Nations, Métis, and Inuit people and their families. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us. Today I have an update on our vaccine rollout, and Teresa and I will go back and forth in talking about some of these slides that we have prepared for you to give you a little bit of a high-level overview as promised earlier, and to share the work that has been still going as we speak. And we'll try to help address some of the questions that have been asked previously. So Mike, are we good to go? The slides?
1 second.
Okay. So starting off with giving an overview of what the provincial plan looks like, and as we have talked about it earlier, so the province has divided the vaccine rollout in 3 different phases. Phase 1 targeting on the high-risk population started December 14 to 2020 in Ontario, and this phase was targeted only to the high-risk population because of the limited supply of the vaccine in the province and also in Canada. Then when we finish off with more vaccine supply, there are which is expected to increase and get us to a stage where we are able to vaccinate more and more people. So that would lead to the mass vaccination phase, which is expected to start March-April 2021, subject to the supply of the vaccine and pending further challenges from any disruption in the vaccine supply. And then this third phase would be a phase where we would hope to vaccinate everyone who wants a vaccine by that timeline, and then get to a steady state where new people, new challenges, or people who are still left to vaccinate, how we can get them vaccinated in a timely manner. So as we know that there are a number of vaccines that are approved in worldwide, and there are different types of vaccine. It all depends on the mode of action for each of these vaccines. So right now there are 11 vaccines that are approved worldwide, and out of these 11 vaccines, only 2 are approved in Canada. And these are all the vaccine type, which is called the technology, or if you want to call it like the mode of action, is the messenger RNA-based vaccine, which includes Pfizer and Moderna. And those are the 2 most widely approved vaccines in the world, with Pfizer approved in 55 countries, followed by Moderna in 37 countries. And then we have other type of vaccines such as the viral vector vaccines and inactivated vaccine and protein subunit vaccine. And among the viral subvector vaccine, we have some of these vaccines that are approved in many countries as well, including Sputnik, which is a Russian vaccine, approved in 14 countries, followed by AstraZeneca, Oxford, which is approved in 11 countries, and then Covishield and CanSino, which is a vaccine that's produced by the I think it's from China. But then we have other type of vaccines such as inactivated vaccines that are also approved in many different countries. And given the vaccine, Canada has pre-ordered many of these vaccines, but some of these vaccines are yet to be approved in Canada. We're expecting some information on AstraZeneca approval from Health Canada shortly. But right now, all the planning and everything that's been based on right now, it's based on the approval of Pfizer and Moderna vaccine that are currently approved to use in Canada. So the next slide, role of Windsor-Essex County Health Unit, and I'll pass it on to Teresa to talk about the roles. Over to Teresa.
So this slide actually gives an overview of the role of the Ministry of Health and also the role of our health unit. So the ministry sources the supply of vaccines, and our health unit securely stores the vaccine supply and ensures that cold chain is maintained. The ministry identifies priority groups, and our health unit is responsible for the coordination and administration of the vaccine to the identified priority groups. The ministry allocates and monitors the vaccine supply across Ontario, and we monitor and report local data on vaccine distribution and uptake. And the ministry also distributes the vaccine supply to public health units and designated hospital sites at this time. And health units are responsible to coordinate, oversee, and hold vaccination clinics to administer the vaccine to residents in Windsor and Essex County. This next slide shows our population demographics, and as you can see that for Windsor and Essex County, 438,000 people, and those over the age of 16 are 328,501. And this is the group of people that we have used our assumptions for when we're planning the vaccine rollout. So right now, residents of long-term care and retirement homes, you have the number there, 4,800 people with staff, 4,300, and essential caregivers are 4,800, and that's designating every resident with an essential caregiver. We also have other congregate care settings, including shelters and other settings, and we have approximately 1,000 residents and 2,000 staff that have been calculated. Individuals that have identified as Aboriginal identity are approximately 9,500 people in our area. Essential workers are approximately 50,000, and adults 60 years and older, 110,000 people. Adults 20 to 59, 228,981. Our planning assumptions for the rollout is that there is a single Windsor-Essex County vaccination plan that is supported by all of our stakeholders, and that there is an established vaccine prioritization protocols will be used by all the stakeholders, and you'll hear a little bit about that in a later slide. The third assumption is that primary care providers and pharmacies will actively vaccinate their patients. And As the vaccine becomes more readily available and supply will not be disrupted. That's one of our assumptions, but that has already happened. So the fifth assumption is that our hospital partner site, essentially Windsor Regional Hospital, is utilized for the ultra-cold storage of the Pfizer vaccine. Municipalities will arrange mass vaccination centers for their residents as requested by our health unit, and that our health system and community partners are providing necessary logistical support, including EMS, hospitals, Ontario Health, Essex County Medical Society, SOHAC, St. Clair College, and the University of Windsor. Locally, we have established a task force under the leadership of Dr. Wajid Ahmed, our Medical Officer of Health. And on the task force are members from each of these sectors. So there is a municipal lead, hospital sector lead, first responder lead, primary care lead, post-secondary education lead, Indigenous population lead, home and community care lead, and also a pharmacist lead. So the responsibilities on the right-hand side, I'm not sure if you're able to read that very clearly, but really we're leveraging all of the existing infrastructures and resources to support a successful rollout for residents in Windsor and Essex County. This slide shows the different phases as provided by the Ministry of Health and where we fit into this. Our vaccination rollout plan has stages, so we don't want to confuse you, but we have 3 stages in our plan. So the ministry's vaccination rollout plan is in phase 1 that high-risk populations are vaccinated, and already we have seen that there has been a focus on congregate living for seniors, which includes long-term care home and high-risk retirement homes. And as we move into phase 2, there will be further vaccination of essential workers and adults in different age groups and at different risks. And in the final phase 3, this is when there's a steady state or a steady availability and supply of vaccinations, and it gets offered to all of the remaining eligible residents of Windsor and Essex County. As we go through the different phases, you'll see that we're using different strategies, and it includes the use of the Windsor Regional Hospital mass immunization site that they have right now at St. Clair College, but also our teams, our local health unit staff have been going in and providing mobile on-site clinics to long-term care and retirement homes. And we see that strategy continuing with congregate care settings and other prioritized populations. And as we get into more of the mass immunization clinics, that's when we'll be using different municipalities and their facilities. So as I alluded to a minute ago, our plan, our vaccine rollout plan for Windsor-Essex County talks about stages. So this stage, we consider it the stage where the vaccine supply is limited, and we have to target key priority populations and provide the people that are most vulnerable with the vaccine. So Windsor Regional Hospital has the Pfizer vaccine, and they have been administering it at their St. Clair site. As I spoke about a minute ago, the mobile teams are essentially our health unit staff going to the long-term care and retirement homes. As well, during the administration to these homes, hospital partners have sent in staffing resources as well to assist the homes in getting their residents and staff and essential caregivers immunized. In stage 1, we do anticipate that the use of our healthcare providers, our primary care physicians, nurse practitioners, and team-based healthcare providers for a prioritized group. In the phase 1 of the province, you'll see that adult recipients of chronic home care are listed as a priority group, and we have been in discussions to make sure that we have avenues for people to get vaccinated in this group. In stage 2, our stage 2 is at a time when this vaccine supply, it basically exceeds the capacity of the resources in stage 1, and we need further assistance in getting the vaccine out to those that are able to receive it. So we'll be continuing to work with our primary care providers and also our pharmacies. We know that working with our healthcare providers in Windsor and Essex County and our pharmacies through the flu vaccine rollout this year was very successful and has been. Our primary care providers provide the most vaccines for flu immunizations to our residents. And in this COVID year, they provided over 104,000 flu vaccines. As well, we have over 100 participating pharmacies with the flu vaccine, and they provided 54,000 vaccines to our residents. So these two groups are very important in our stage 2 and in the rollout of the vaccine. As well, we will continue with our mobile teams based on prioritization and in specific groups, making sure we reach vulnerable groups that are not able to attend other sites. And in addition, we would have targeted mass vaccination clinics based on the prioritization and vaccine supply. So a good example of that would be our agri-farm workers, where we know in the Leamington area, we'd like to be able to vaccinate them probably at a mass immunization clinic when we're able to. The final stage 3 is when our vaccine supply is very regular, that we have so much vaccine and we need to get it out to all of the remaining people that would like the vaccine. And that's where our mass vaccination sites are being developed in Windsor and Essex County, and making sure that everyone who wants the vaccine will be able to have the vaccine at one of these sites or through one of the other avenues already discussed. So we have used the IMS structure, which is called Incident Management System, for the rollout of the vaccine. And I'm not sure how clearly you can see it, but basically our incident commander would be our medical officer of health, which is very typical. Health units traditionally have provided mass immunization clinics for flu, H1N1, and as you know, we're in the schools every year providing grade 7 vaccinations to our students. And also we provide vaccinations when there are outbreaks. So the incident commander, under his direction, we have developed a Windsor-Essex task force for the vaccine rollout with many leads, and I talked about these previously, the municipal leads, hospital, first responder, primary care, post-secondary, Indigenous population, home and community care, pharmacists, and our public health. As well, through the medical officer of health, there is a Windsor-Essex Prioritization Committee. We'll hear a little bit about that in a future slide, and that committee is responsible for looking at the overall prioritization. But if there's subgroups, then they have to determine of those subgroups who is prioritized for the vaccination. Overall, with the IMS structure, there's a planning section which is happening right now as we plan not only for for mass immunization clinics, but we're developing plans with each of the rollout strategies. So we are meeting actively and having good conversations with our primary care providers, pharmacists, and others. Then the operations, logistics, communication, human resources, all of these are important elements in the IMS structure. Communication, we are working with St. Clair College for a website and a public portal to have information all in one place. So that's the IMS structure in a very quick overview. This is a slide that it provides kind of a pictorial of our stages and what we hope to do. So basically in stage 1, again, as we roll out the vaccine, we have our distribution strategies, and we'll be bringing on healthcare providers, pharmacists, and right now we're doing the mobile clinics for our prioritized groups. And as more vaccine becomes available, we'll move into stage 2, where we bring on more of the clinics and the pharmacists and primary care providers, and we continue on in stage 2 until this supply is so great that we're able to offer vaccination clinics through mass immunization while keeping all of these other stages operating as well.
Right. So I will now talk about some of the vaccines that we have distributed so far. So I know there's been this question, and we've been asked about the number of doses that's been distributed in Windsor-Essex. So this is an overall view of how many doses of vaccine that's administered in Windsor-Essex. When I'm sharing this data, I want to use a word of caution, is all of this data is extracted from the Ontario Ministry database, which is called COVAX. And at the beginning of this process, there has been some challenges with COVAX in terms of the data entry, and not all data may be captured and represented as it should have been. So with just word of caution, there's been a lot of work that's been done to clean the database, but I just want to remind that I just want to caution that the data may change based on some of the future clarity or cleaning of the database, but this is as accurate as we have as of yesterday. So looking at Windsor and Essex, we received more supply of Pfizer versus Moderna. And as Teresa mentioned, Pfizer vaccine is received directly by the Windsor Regional Hospital and implemented through their mass vaccination clinic to the residents who are eligible based on the provincial direction, and the Windsor Regional Hospital through their team administered all these vaccines to the people. Moderna, this is the vaccine that the health unit received directly from the ministry, and we distributed also based on the priorities that was identified by the ministry. So looking further into the number of doses that were administered by the organization type, so all of our vaccine, short of 4 doses, went to the long-term care home and retirement home directly through our mobile team, and all the vaccination happened at these sites and included mainly the residents, and then followed by their healthcare worker as well as essential caregivers who were available on site and were eligible to receive the vaccine. And as Teresa mentioned, there are still some residents who were unable to get the vaccine because of their illness or because if they had active disease, and those continue to be our priority. And that number ranges between 300 to 400 residents that still need the vaccine, and they will be prioritized as soon as they are able to get the vaccine and the vaccine supply comes to our region. Looking at the Pfizer doses that were administered by organization type, and again, just a word of caution in terms of the accuracy of the information from how it's reported in the COVAX system. So as we can see that the hospital, long-term care home workers, essential caregivers received their vaccine doses, as well as in addition under the other category, there are a number of other healthcare workers from many congregate settings, and some of the frontline healthcare workers also received some of these vaccines are captured in the other category, which is not yet defined in the COVAX system, but eventually will be included and further breakdown will be available for us, while the rest of the other sectors also received some of these vaccines through the Pfizer doses. With respect to Moderna doses, by reason, there are further breakdown of all of these doses that was given to us, including the residents who received the doses in the long-term care home, in the retirement home, followed by the healthcare worker, and everyone else that have received the vaccine. So these are all the breakdown of each of these group by vaccine that they have received. So as we know, our current priorities for vaccination is long-term care homes, which includes residents, staff, and essential caregivers, as well as retirement home that are deemed as high risk and their residents, staff, and caregivers. And then the healthcare workers based on the prioritization framework that was released by the ministry. And then based on that prioritization framework, there's still a number of work that needs to happen and is happening to make sure that the vaccines are going into the right group in a timely manner, in a more equitable and ethical framework. The upcoming priorities, as we know and informed by the ministry, is the adults recipients of chronic home care, seniors 75 plus, and then seniors between 60 to 75, essential workers, and then communities at risk of having more severe consequences of COVID when they contract it. In terms of the prioritization process, the way it works is the province identifies the priority groups with high-level guidance. There is a prioritization committee that is happening at the provincial level, which has the specific guidance in terms of which population that they want to prioritize. The most recent work that has been shared more publicly is with the healthcare worker prioritization document, which was shared by the ministry. But even within that prioritization document, there's a number of other steps that needs to happen to ensure that all these priority groups are receiving the vaccine in a more ethical way. So what happened, as per the ministry direction, we have established our local prioritization committee and Windsor-Essex prioritization committee to make sure that we're getting the guidance from the ministry and then operationalizing it locally, because even when we are talking about a healthcare worker can range all the way from a healthcare worker who's working in ICU, a healthcare worker who is working in an uncontrolled environment with potentially COVID positive patient, versus a healthcare worker who is doing mainly, let's say, an online consult rather than having to see someone in person. So all these range of healthcare workers, it does require some thoughtful process of prioritization before they can get the vaccine. So right now, our prioritization committee membership includes representation from diverse background to make sure that we are capturing all the various perspective and the lens that each of these individuals from their respective work in the community are bringing. So Dr. Ross Moncourt, as we know, Chief of Staff at the Erie Shores Healthcare, is bringing in the hospital healthcare worker perspective into the discussion. And Chief Pam Mizuno from Windsor Police Services is bringing the perspective of the first responders, essential workers in the front line of response for pandemic, and their perspective in dealing with this prioritization process. Executive Director Kathleen Thomas from Multicultural Council of Windsor-Essex, bringing in perspective of newcomer, immigrant, marginalized population, racially, ethnically diverse communities and their challenges, and using her organizational experience and perspective in the prioritization process. Karen Vidal is the Executive Director for the House of Sophrosine, which is a service for the mental health and addiction, especially for women, and she's bringing in her perspective from that lens. Elaine Isaac is the Manager for Integrated Healthcare for the Southern Ontario Aboriginal Health Access Centre, bringing in the Indigenous perspective to the Prioritization Committee. Dr. Suzanne McMurphy, she is the Associate Professor from University of Windsor and also the Chair of the Research Ethics Board of University of Windsor, bringing her ethical lens and perspective into the conversation. And then obviously myself included in the Prioritization Committee to make sure that I am leading the conversation based on the provincial direction and also bringing in the medical officer of health perspective to the discussion. So we'll stop here and we'll be happy to answer any questions you have. I know we've covered a lot of the items, and before I take question, I just want to acknowledge that how much work and effort that has been went into this planning, and Teresa and along with our team have worked nonstop to make sure that all of that the work is completed, and we can move forward in a very short period of time. If the ministry comes and tell us that you got the vaccine, go and deliver, we should be able to do that. So there's a lot of work that that has already happened and will continue to happen as we continue to refine and refine until we get all the people vaccinated in our Windsor-Essex area. Thank you.
We'll now take questions from the media. We'll start with AM 800.
Teresa, I do have a question about the presentation, but first, I read on Friday that Moderna is delaying their vaccine shipments to Canada. Will that impact the local health unit at all?
Well, we are anticipating our vaccine to come this week, and so we don't know exactly if there is a reduction, but every dose of our vaccine is needed for the second doses of Moderna, so we are hoping that we obtain those second doses, but we're waiting for more information.
Okay, thank you. Dr. Ahmed, switching gears to the presentation, going to the page where the Moderna Pfizer administered, was taking place. So more than 15,000 when you combine the two. That's 15,000 doses, correct?
That is correct, yes.
That number in a short time, I believe the hospital started at the end of December, and then the health unit was beginning of January. Just in a month's time, 15,000 doses, just your thoughts. Seems like a lot was accomplished, like you said, in this past month.
Yeah, no, absolutely, and I think that's why kudos to our our hospital to have us a system and a clinic ready to vaccinate a large number of people. We had the luxury of having the St. Clair College site, which was initially, as many of you know, was built as a surge capacity unit for if there's any overflow of patients. So luckily we didn't get there, but we were able to utilize the same spot to vaccinate as many people as possible. And what we know, the capacity is much higher, and we don't have enough vaccine to use the full capacity and full potential of that single site only. And we have seen the capacity of our health system based on the work that the health unit has done. We have been doing mass vaccination clinic for a number of years. 2009, H1N1, all the health units across the province, including our own, were able to vaccinate large number of people in a very short period of time. Within a few weeks timeline, a large number of people were vaccinated. So I think we do have that strength. The only limiting factor right now is the supply of vaccine and the responsibility to share and distribute these vaccines in a much more fair and equitable way, in an ethical way, to the right people. It's the rate limiting step and the technology to make sure that all of that data is captured. So those are the rate limiting point. And when we were working on the plan, and Teresa can add more if she choose to, but we do have the capacity all the way from vaccinating even more than like 10,000 people a day. So that's the capacity that we can hit if we were told that, this is the supply that you're getting, make it happen. With using all these infrastructure and resources that we have available, we can easily accomplish that as soon as we get the go ahead and just put everything in full gear. So we are definitely pleased with our progress, but I think there's still a lot of work that needs to happen, and we'll continue to make sure that we vaccinate people in a timely way and keep our community safe.
For the COVAX system, like you mentioned, so the information is inputted through COVAX. I guess in the category where it said other, will that determine if individuals that were not supposed to get the vaccine this time around, would that come up under the COVAX system in the other category?
Well, there are, as I said, within the COVAX system, you have to identify not only a service delivery site, but an agency, if you can attach an agency name to where these agencies, who these agencies are who are getting the vaccine. So part of that is if the agency is not registered, and as I mentioned in the earlier timeline, some of these vaccines, COVAX, were not as readily available. So there were some paper-based forms that were completed, and then there were service delivery site, whether they were not registered into the system. So all of that data cleaning issue can be captured in the others category, but that doesn't mean that those are not the people who shouldn't get the vaccine. So I think it's the wrong analogy. The COVAX system doesn't preclude you whether you are eligible or whether you are not eligible to receive the vaccine. It's just a record monitoring system. And if you can enter the data into the system to capture that who is vaccinated and who's not. So that's all it does. I think at the end of the day, it is us who is making those decisions that who gets the vaccine and who doesn't get the vaccine.
Thank you. Great presentation. Thank you very much.
Any questions from CTV?
Yes, hi. Good morning, Teresa. Good morning, Dr. Ahmed. I'm kind of going a little off topic today, but I just wanted to get your take on long haulers and what you know about that topic.
Well, I think there is still, this is an area currently being studied in terms of the long-term impacts of COVID and how people are still recovering from that infection and what they're going through. So I can share from our public health perspective. I don't want to get into the specific clinical details of all of that, but that is a concern in terms of our knowledge and our understanding of the disease. That why some individuals takes months and months to recover, whereas others who may have a mild infection and sometimes they don't even know that they have the disease. So I think it's an ongoing area of research, and we still need to learn more. That's all I can say at this time, Bob.
Okay, because I've come across somebody who's a long hauler, and he's having a hard time with it. So, for people like him who are, I guess suffering silently with it, well, what advice do you give them? Can they call? Who do they call? That kind of thing. What supports are out there for them?
I'll have to get back to you on that, Bob. I would try to connect with my colleagues to see what kind of resources and support systems are available. But as always, we say that your best option is to connect with your family doctor, and then maybe have him or her connect you with the specialist support as needed. At this time, as I said, there's a lot that we need to know about this disease. This is still a very new disease. It's just a little over a year that we have been experiencing COVID and learning how to manage the disease, learning how to prevent the disease. There are very few approved treatments that are available. There are a number of experimental treatments that are currently on the way. So the best option is to connect with your family care provider, and I will get back to you if there are any specific supports or direction available from any of the healthcare agencies in the province.
Okay, yeah, please do. I appreciate that. Thank you. Also, if I may indulge me here, a couple topics for a colleague of mine, or a couple questions, I mean. So do you feel there's enough safety measures in place right now for students to return to school next week?
So I think the safety measures were always in place. There was never a compromise in terms of the safety measures of students in the school system. The challenge is the community cases, the background community cases, and people, including staff, students, adhering to these measures and how strictly that they're adhering to these measures. We have seen time and time again that when the schools reopen, there were a lot of focus and emphasis on following these measures, and everyone was following the measures to the dot. But then we have seen that people started to get complacent, and that includes not only just the student, but also the staff and the teachers. So we want to make sure that people recognize that how important it is to follow these measures to keep everyone safe. So it's not a matter of the measures and their safety. It's all about ensuring that these measures are followed and all the appropriate infection prevention and control measures, including physical distancing, is followed to the best to prevent any spread of cases in the school system.
All right, and one last one, if I may. I mean, we've learned a lot throughout this pandemic, and we continue to learn. It's an evolving topic, but do you still feel comfortable sending kids back to school? Because, you know, things will change, who knows, right? But as of right now, would you feel comfortable sending them back to school?
Well, I think we understand the importance of having in-person learning for many of the students. The in-person learning environment is the best environment that can be used to train these developing brain. And so we do support that there should be that ability. The key is how we are keeping our schools safe, and if there is any ongoing risk in the school system. So those are some of the things that we always need to consider. But as a parent, I think many of us may have a different level of expectation or a level of risk assessment. We may see the same information, but we may take different direction in terms of how much risk we can see versus someone else can see that. So I think that's the fine balance. And once the schools open, I'm sure that the parents will have to look into their own child's situation, learning needs, and the risk and benefit of whether sending them to school versus having them do virtual learning. So that's the critical piece, and I think I would definitely want every parent to ask this question. Look at your child, look at your child's need, and look at your own risk assessment and how you want to make those decisions despite all of these measures that are put in place. And as I said, these measures are good measures as long as it's followed, and if it's not being followed, then it definitely increases the risk.
Yeah, I appreciate your time and for answering those questions. Thank you.
Thank you.
Any questions from CDC?
Hi, yes, good morning. We've heard today that public health labs are going to start testing for the new COVID variant. I'm wondering if that includes samples collected locally, and also what does that mean? Like, would we be hearing from day to day, you know, how many samples were positive for the variant?
So what we know is all the samples that are going from Windsor-Essex or even from any of the health unit, a randomly selected batch of these samples go to do the genomic sequencing to find the variant of interest or maybe any variant that we can see from the SARS-CoV-2 virus right this time. And in addition, the health unit do have the ability to flag some of the potential specimens for variant testing on top of the random testing that's been happening at the lab system. If a health unit is seeing an unusual spread or maybe a quicker spread than what is expected, or maybe a travel related case that is of interest, we can flag those specimens directly to the lab for variant testing. So that's the process so far. We do receive daily reports of variant testing from the province and where they came back positive. Knock on wood, so far, Windsor-Essex is, we haven't seen any variant to date.
Thank you very much.
Any questions from Blackburn?
Sorry, yes, just a clarification. You may have mentioned this already. The doses that you're expecting to come in of Moderna, as you're going into these homes to administer the second doses, are you also doing first doses for people who are unable to get it the first time, or at this point you don't know if you have enough doses?
So we intended to do first doses when we went back for second doses, but the homes that were completed on the weekend did not get any new first doses. So until we get our shipment, we won't be able to do the first doses, but we do intend to circle back and administer first doses when we have the vaccine supply.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. How different is this rollout from the rollout of the annual flu shot, to give people some perspective?
So with the annual flu shot, our campaign has typically, well, I've been at the health unit a long time. So in the early days of the flu vaccine, there were mass immunization campaigns, and we'd have mass clinics throughout the city and the county. That was the approach. And then and we always provided vaccinations to the hospitals, always got it first, along with anyone that was most at risk. As well, primary care providers received the vaccine. As pharmacies became one of the strategies for the rollout of the flu vaccine, there was less of a need for our health unit to do the mass immunization clinics. So through the primary care providers and the pharmacists, we were delivering quite a bit of the vaccine. And so that's kind of how our approach has been locally. We do have an annual flu clinic every year. We partner with the University of Windsor and make sure that any of the students and international students all get immunized for the flu. But essentially, the primary care providers and the pharmacists have done a great job in getting out the vaccination to our community, and as well as others. So long-term care and retirement homes, with the flu season, we provide that vaccine to the retirement homes directly in the long-term care homes, and they vaccinate their residents and staff as well. So the difference with the COVID vaccines is that we anticipate that we will vaccinate 328,000 people twice. So that's, looking at 650,000 doses of vaccine within, a month, or whatever, it's 28 days apart for the Moderna. So it's just at a bigger scale. It's 2-dose right now. And so it really is using every resource, every infrastructure, all of our healthcare partners to get this accomplished. We know with the flu vaccine as well that typically our health unit receives about 220,000 doses, and so that's even less than what we're anticipating for COVID, based on the fact that this is a pandemic. We know the vaccine has been long awaited for the pandemic to come to a close, hopefully.
And Dr. Ahmed had mentioned the H1N1 vaccine rollout. I expect that this one is much larger than that one even. Is that the case?
Yes, so I was here as well for H1N1, and we had mass immunization clinics like nonstop everywhere. I feel like this one will be based on the prioritization that has been led by the province and then locally will be supported. I think it'll be more directed and targeted. But H1N1 was just created a lot of people coming for the vaccination. If you were around, you'd remember long lineups, and so learning from that experience, hopefully we'll have a wider distribution of the COVID vaccine, and use the mass immunization clinics when it is available to everyone. But hopefully others will have already been vaccinated and won't have to, come out to the mass immunization clinics if they're already been a targeted priority.
And finally, just so that I make sure that I understand this, the difference between the local stages of the rollout and the provincial phases is the local stages seem to be more based on the supply. Is that the case?
Essentially, that's our issue right now, is having the supply. So as we get confirmation of a regular supply, it does change our focus, or it's more inclusive, I guess is the word. It just expands that group that can get vaccinated. And so you're correct. It's very focused on having the supply and having the, the healthcare workers and the right infrastructure to get this supply into our residents.
Okay, thank you.
Any additional questions from AM 800? Teresa, I'm not sure if you have this information handy or in front of you. This is back-to-back days without a new death. Do you know when the last time we had that in Windsor-Essex?
No, I don't. But it was a relief to see that, I have to say. But no, I'd have to look back and see.
Okay, no problem. And then the second question, same thing. I'm not sure if you have this right in front of you, but just looking back at our stories, the Pfizer vaccine, the first dose was administered on December 22nd. And then for Moderna, I know the health unit said it was coming to town on December 30th. Originally it was January 4th, but I know that date was changed. When was the first Moderna dose administered?
It was January 1st.
January 1st. Okay, perfect. Thank you very much. Any additional questions from CTV?
No, I'm good today. Thanks, guys.
Any additional questions from CBC?
No, thank you.
Any additional questions from Blackburn?
Yes, good morning. Just a little off topic. We mentioned the flu vaccine. Back in December, there was a news release that got sent out that said that we had our first confirmed case, and I think it was rescinded. Have we had any confirmed cases of the flu here in Windsor-Essex? And then if not, is it just because there's not testing being done, or is it just an odd year?
Well, I think, first of all, yes, we did issue that earlier media release, and then when the confirmatory test was done, flu virus was not found, and that's why we rescinded that notification. The testing is already happening, and as we know, the key driver for flu spread is pretty much the same as we see with many of the COVID measures. So truly the measures of physical distancing, people wearing masks, is working to prevent the spread of the prevent the spread of flu. The difference is when we're talking about how quickly a virus can spread despite some of these measures versus how difficult it is for the virus to spread. And there's a number of science that can go beyond that to say that what's the infective dose, what's the mode of transmission, how long the virus can survive in an environment, how close that the person needs to be in order to acquire the disease. So all of that factors in terms of the disease transmission. What we are talking about COVID is much more quicker. It does have a low infective dose. It does have a high survivability of the virus in the atmosphere and in the environment that increases this spread very quickly. So even when you're saying that, same method, let's say if someone is contracting COVID and it's easily passing it on to other, but not necessarily passing the same flu virus, for example, in the same manner, the difference is all of those signs that goes behind in terms of the infective dose, in terms of the survivability of the virus, and how quickly the virus can spread from one person to another. So if you factor that in, that's why you're seeing the difference. So even half measure can be useful for preventing the spread of flu, but the same half measure cannot be good for COVID. You need full measures to prevent the spread of COVID because COVID spreads much more quickly. And right now, as we have seen, it's much more deadlier than the flu virus and in terms of making people sick. I hope that answers.
Thank you.
Any additional questions from the Windsor Star?
I suppose I'm just wondering, in your own words, what are the next steps for the health unit right now?
So the next step for us is we continue our work on the prioritization piece. So that work is ongoing. We continue to Teresa leading that work of the planning working with all the various stakeholders including our primary care providers, including our pharmacist group, including our municipalities, including our hospital partners and everyone else. We will continue to give and add more and more details to each of these sub-strategies. And then basically we'll just wait for the province to tell us the good news that we're getting more vaccine, so we can put all of these measures in place. And as we said, we do have the capacity to ramp it up our daily vaccination anywhere between 10,000 to 20,000 based on the plan that we have. And we really hope that specifically our primary care providers and pharmacies, who have been very instrumental in the flu vaccine rollout, and as Teresa mentioned, the entire strategy where we used to have these mass vaccination clinics, but now all of these mass vaccination clinics are pretty much disappeared, and then focused on the pharmacies, and the primary care providers will take the lead in doing that. But then even if that supply exceeds, we will set up all these mass vaccination clinic in all of these municipalities, especially in the municipalities that has a limited number of opportunities for the primary care providers and the pharmacists to engage. But the hope is when we are all working together, we can easily accomplish up to 10,000 to and as high as 20,000 doses a day to get our community vaccinated as quickly as possible.
Okay, thank you.
Thank you, everyone. Have a great day.
Thank you.
Thank you.